All right, well, here's the heat map we've been looking at. We are still at a high transmission. We're starting to see a little low and moderate counties starting to pop out. But recalling the category, the CDC category, it's a relatively low threshold. The last time that the United States was, on an average, below the high category was in July. And Walla Walla County was there mid-December before this Omicron surge. Here's a visual of the case rate curve for the United States, and you can see a pretty precipitous drop. And also, I'd like to show this slide just to show the magnitude of this wave compared to the prior waves. But looking at our most recent case rate curve here from the United States, we see a pretty significant drop over the preceding week. And this data does lag about 5 days. Hospitalizations are dropping as well. They dropped 18%. This data lags a little bit more. That is as of February 1. U.S. deaths, however, increased slightly. We've talked about how this is a lagging indicator, and so as cases fall, hospitalizations fall, deaths might increase, but then they'll start to decrease after that. Looking at Washington State, if you look at the 14-day case rate curve, it looks like there's a little bit of a plateau. But if you look at the 7-day case rate curve, which shows changes a little more quickly, if you will, we're seeing a significant drop off. If we look at Eastern versus Western Washington, this drop off in case rates, the west side is ahead of the east side. Most of our persistent case rates are mostly related to higher population centers such as Spokane. And I'll show you in a minute that our case rates seem to be dropping. We do show this case rate ranking per county. We've kind of hovered in the 3 to 4 range over the past 2 weeks. And now our case rates are dropping. So hopefully we'll see that starting to drop even further. Washington State hospitalizations have kind of plateaued. It sounds like on the west side, they seem to be improving. In talking to our local hospital here, our hospitalization rate seems to be stable, and I'll get to that in a minute. The Washington State death reporting is behind by over a month, and that did show that the deaths were rising, but I don't have any more up-to-date data than that. Looking at Walla Walla, according to the DOH dashboard, which lags quite a bit, January 22nd was when they reported this data. But if we plot our internal data, we can see that we've had a 23% decline in cases since January 30, which is a welcome sight. We noticed towards the end of last week that the cases had plateaued over about a 4 to 5 day period, and I'm hoping that this is showing that we're on the downhill slide. That's a pretty significant drop in the course of a week. Our hospitalization in Walla Walla County, I just got off with the hospital, and we've been hovering between 15 to 20 hospitalizations per day. This slide will be updated today. This is as of the 4th, which was Friday, and we'll update that today. But we continue to see that unvaccinated individuals and individuals who are not up to date seem to have the highest hospitalization rates. So once again, vaccinations do help prevent hospitalization and severe illness. We've seen a significant decline in our vaccines. Total vaccines last week were 129, and this has included the same cadence that we've had in previous weeks. We have 3 clinics at the Southgate campus, and then our mobile efforts. The people initiating the vaccine series is pretty small, and the majority of our business is booster doses. I think we talked last week or the week before that the FEMA funding may be ending at the end of March. And when numbers get this low, it just makes me wonder about the future of the Southgate site. And I'll work with Commissioner Tompkins we can discuss that. I know Commissioner, that was one of the things that you wanted us to do, is make sure we had vaccines accessible, and we'll just have to talk about the return on effort as we move forward. Looking at testing, we've had a significant decline in testing. when I last reported, there were an average of 175 tests per day, and now we're down to about 90 tests per day. So I think in summary, I've had a couple slides over the past couple of weeks saying that we can get through this together, but I think my message today is we are getting through this, and there is a light at the end of the tunnel, and so we just need to keep doing the usual mitigation measures and keep moving forward. And I'm just very optimistic. And that's the end of my report.